Thank you very much for inviting me to join you today. It is a real privilege to be part of this symposium, bringing together people who are united by shared commitment, supporting the mental health and wellbeing of our NHS and social care workforce across Wales. And I'd really like to begin by acknowledging everyone, clinicians, practitioners, researchers, academics, and those with lived experience. And I would also like to thank all of today's speakers and contributors in advance for the knowledge, insight, and expertise that they will share over the course of the symposium. The information, evidence, and reflections that you impart today are vital in helping us deepen our understanding and improve the way that we support our workforce. And I also want to pay tribute to the Canopi team themselves. Canopi has become a vital source of support for those who care for others every day, and its success is a real testament to your dedication, professionalism, and compassion. Our NHS and social care workforce is truly the backbone of public services in Wales. Every day, staff show extraordinary resilience, skill and kindness in the most demanding of circumstances. They care for people at their most vulnerable, often while managing heavy workloads, emotional pressure and the cumulative impact of stress and trauma. The COVID-19 pandemic shone a stark light on this reality, but the truth is that pressures on the workforce existed long before, and they do continue today. It is therefore both right and necessary that we place the mental health and wellbeing of our workforce at the centre of our priorities, not as an afterthought, but as a fundamental part of delivering safe, compassionate and sustainable care. Canopi represents exactly the kind of proactive, compassionate approach that we need. And as a free and confidential mental health service for NHS and social care staff in Wales, Canopi removes many of the traditional barriers that prevent people from seeking help. It is accessible, trusted and tailored to the realities of working in health and social care. The fact that Canopi is so well utilised tells a very important story. It tells us that when we create the right conditions, when support is easy to access, stigma is challenged and confidentiality is respected, people will come forward. That is not a sign of weakness. It is a sign of strength, self-awareness, and also real professionalism. Welsh Government is proud to fund Canopi, and we remain committed to ensuring that services like this continue to be available, sustainable, and responsive to need. Alongside the delivery of high-quality support, research and evidence play a crucial role in shaping effective mental health services. And research also has a powerful role in destigmatising mental ill health. By grounding conversations in evidence, we move away from myths and assumptions and towards understanding, empathy and informed action. The work being shared at this symposium, whether research findings, service evaluations or insights from practice, is essential in building a stronger, more resilient system. And I want to thank all of those involved in generating and sharing this knowledge. Your work helps ensure that policy, practice and funding decisions are informed by evidence and that real-world experience. Despite progress in recent years, stigma remains one of the biggest barriers to people seeking support. This is particularly true in caring professions, where there is often an unspoken expectation to cope, to be resilient at all times, or to put others' needs before your own. For too long, mental health has been treated differently from physical ill health. Experiencing anxiety, depression, burnout, trauma is not a personal failing. It is part of being human, particularly in emotionally demanding roles. By openly talking about mental health, by sharing research and lived experience, and by visibly supporting services like Canopi, we send a powerful message. It is okay to ask for help, and it is okay not to be okay. Destigmatisation does not happen by accident. It requires leadership, commitment, and that cultural change at every level of our organisations. Leaders play a critical role in setting the tone through the language they use, the behaviours they model, and the priorities that they champion. Creating psychologically safe workplaces where staff feel able to speak up about their well-being without fear of judgment or negative consequences is essential. But culture change is not just about senior leadership. It is about teams and peers and everyday interactions. It is about checking in with colleagues, listening without judgment, and recognising when somebody may need that support. Services like Canopi do not replace supportive workplaces. They complement them. Together they create a system where well-being is embedded, informed by evidence, and continuously improved through learning and research. So Welsh Government is clear in its commitments to improving mental health and wellbeing across Wales, including for our workforce. And our investment in Canopi reflects our belief that prevention And early intervention are not only the right thing to do for our individuals, but it does also make sense for our public services too. Supporting staff well-being helps with retention. It reduces sickness absence and ultimately improves the quality and safety of care for patients and service users. So I want to briefly acknowledge the importance of lived experience in shaping services and conversations around mental health. Hearing directly from those who have access support, including Canopi, is one of the most powerful ways to challenge stigma. Personal stories, alongside research and evidence, helps us understand the real impact of our decisions. They remind us that behind every service is a person, and behind every person is a story that deserves to be heard with respect and compassion. In closing, I want to thank all of those, again, contributing to today's symposium for the expertise and insight and evidence that they will share. The learning from today will help really inform future practice, policy and services. Caring for others should never require sacrificing your own well-being. A healthy workforce is not a luxury, it is essential. So let's continue to normalise conversations about mental health, to learn from evidence and experience, and to build services and workplaces where asking for help is seen as a strength. Diolch yn fawr.